Welcome back. We're starting on the second to last lecture of the year. So, two more to go, and the topic is going to be treatments of psychological disorder. Now, throughout history, there have been a lot of strategies for dealing with people that had mental illnesses. In the 1800s, mid to late 1800s, the strategy that people came up with was to house them in these monstrosities, these huge institutions that might have many hundreds of psychiatric patients living there full time. So that the best thing that people came up with in the mid to late 1800s was to basically warehouse all of the mentally ill that they could gather up in society and stick them in these monster institutions. And often they'd stay there indefinitely. They may spend their entire life there without ever seeing the outside of the grounds of these institutions. In the second half of the 20th century, starting about 1950 or so, there was an increasing move away from the institutionalization of people with mental illnesses, and instead the goal was to see if they could be treated more or less within the community, so still being members of the community rather than being removed from them. And also a strong push was to use drug treatments as a way to avoid having to institutionalize people. And one reason for this was that people started to worry that the institutions themselves started to make people more mentally disordered than they were to begin with. Just that these were not friendly environments for people. For one thing, it gathers all the people with mental disorder in one place, so all the people you come into contact with have some sort of a mental disorder. People started to think that maybe that's not the best situation for folks with mental illness to be in.
So we're going to talk about two different classes of treatments for psychological disorders, and these are biology-based treatments and behavioral-based psychotherapies. So with the biology-based treatments, it really approaches mental illness like it's a disease that can be treated medically. So this would be something your psychiatrists and your physicians would adopt. Psychotherapy treats it more as though it's caused by emotional distress. So the treatment there would be a form of therapy involving resolving these sources of emotional distress.
Okay, well, we'll start with the more biologically based treatments for mental disorder. So drug treatments. Lots of disorders are treated with medication. There are 4 different types of these kinds of medication: antipsychotics, antidepressants, tranquilizers, and lithium carbonate. And they each have a role to play in different mental disorders.
So antipsychotics are used for treating the positive symptoms of schizophrenia by reducing the activity of the dopamine circuits. Now remember, those positive symptoms would be their bizarre delusions, their disorganized inappropriate behavior, and disorganized and incoherent speech. Now, the problem with these drugs is that they have some side effects that are uncomfortable for people. So these would be tremors or dry mouth. And also these drugs don't reduce the negative symptoms. So that loss of motivation, loss of speech.
Catatonia, catatonic stupors.
So examples of these drugs are Thorazine, Haldon, and Clozaril.
So another group of these drugs that are used for mental illness are called antidepressants. And some examples include monoamine oxidase inhibitors, like Nardil would be a brand name for one of these, tricyclic antidepressants like Elavil, or selective serotonin reuptake inhibitors like Prozac, probably the most famous one of the group. So these are for treating depression, anxiety, phobias, and obsessive compulsive disorder. Basically, mental distress is the thing that they seem to alleviate. They're like happy pills. You feel upset or sad, they're going to make you happier.
So these drugs work by increasing the levels of serotonin, norepinephrine, or dopamine in the brain, and this promotes that calmness and increased arousal. There are some unpleasant side effects though, and these would be dry mouth, headaches, nausea, restlessness, and 1/3 of all patients report a reduction in sexual desire.
And some of the side effects, it varies from one person to the next, but in some cases, people who've taken Prozac have developed quite horrifying motor deficits and inability to coordinate their walking and their hand movements and arm movements. So that's a relatively rare outcome of taking these drugs, but these are medications that can, in some cases, have quite severe side effects, negative ones. So just an illustration of how these different types of antidepressants work. They all work on at the synaptic gaps between neurons in terms of the amount of neurotransmitter that's available to stimulate the next cell over. So tricyclic antidepressants inhibit reuptake at serotonin and norepinephrine synapses, and that elevates activity in those synapses. And these are neurotransmitters related to the feelings of euphoria and arousal that could get somebody out of a depressive funk. Okay? MAO inhibitors disable MAO enzymes that would usually metabolize and inactivate neurotransmitters at these types of synapses. And then selective serotonin reuptake inhibitors, they slow how quickly these serotonin neurotransmitter gets reuptaken in the synapse. So the activity increases for those only at serotonin synapses. So it's specific to serotonin. Now all of these are going to increase the levels of these neurotransmitters floating around and just increase those circuits in the brain, the activity of them. And since they're associated with happiness and arousal, that'll make you feel better if you're depressed. For many people, not everyone.
Well, tranquilizers are another category of drug, and these mimic the neurotransmitter GABA, which has that inhibitory function in the brain, and this produces a very powerful calming and blissful effect. So examples of this drug would be Valium, Xanax. Okay? These are best suited for treating problems with really high anxiety that's associated with phobias and panic disorders. The problem is this drug is highly addictive. Again, it has such a blissful effect that people can begin to want that calm euphoria.
Lithium bicarbonate is specifically designed to deal with bipolar disorder. Bipolar disorder, again, is when a person alternates between phases of mania and then deep, deep depression and other across time. So a person fluctuates wildly from being highly manic and super energized to being quite depressed and unable to do anything. So this lithium bicarbonate has the effect of stabilizing this roller coaster, mainly through moderating the levels of norepinephrine that exist in a person's bloodstream. That's the hormone that's released by the adrenal glands.
The problem with this drug is that too little of it doesn't help at all, and too much may be fatal. So getting the correct dosage for this drug is really difficult.
And there's also the side effects mentioned here that a person can develop tremors and kidney damage as a result, because it does act directly on those adrenal glands that release norepinephrine, which, of course, the more norepinephrine, the more physiological arousal a person experiences.
Well, there's problems with medicating psychological disorders, and one of these is the placebo effect. So we mentioned this earlier in the course, and this is when people will get better because they expect to get better, not because of any treatment. So here, many people can respond well to a drug because of their own expectations about the drug and how it's going to make them feel better. And it's not because of the drug itself. Well, this means that new drugs may appear to be effective when introduced, but can be much less effective once the excitement dies down. So once everyone is over talking about this new miracle drug that's going to cure this problem, then all of a sudden the effectiveness can be reduced as time passes and people realize it's not a medical miracle. One meta-analysis that was done on antidepressants, because these are prescribed quite frequently. So a meta-analysis is when you look at a large number of different studies. So in one study, you might look at the behavior of individual participants. But in a meta-analysis, you look at the results of different studies, which then have a number of patients. So you get a much larger number of participants contributing to your analysis. And it was found that patients report no benefit above the placebo effect with antidepressants.
Well, that's depressing, I think,
It is.
considering the amount those types of drugs are being prescribed to people, both adults and children. Here's another problem. Many people stop taking the medication because they must be taken in a strict ritual way. A routine must be established because the dosage is so key for the effectiveness of these medications, if they indeed are effective. Many people stop taking them, and consider that a number of people taking these medications have a severe mental illness, and then expecting that they'll follow a consistent routine in taking the medication is a high expectation for these people.
Well, and 1/2 to 2/3 of all patients stop taking their medication.
Right. It's either because they're just not organized enough to do it, or they just can't. They don't appreciate the side effects. Many people report changes in their personality and their ability to think as a result of taking these medications, and so ultimately stop taking them for that reason. And these medications just aren't going to be effective unless they're taken it just the way they're prescribed. Also, as I was sort of mentioning, the dosage must be just right for anybody to treat their mental illness with a drug treatment. So a person might get a prescription initially and then figure out whether that's the right dosage for them. And it's always a game to figure out what's the right amount for this person, because it varies from one individual to the next so widely that it can be quite challenging just to figure out the right dosage. And as Lana was mentioning, if you don't, for example, get the right dosage of lithium bicarbonate for somebody, if you give them too much, they could die, and too little is not enough to make it effective. So that's a challenge involved in drug treatments.
Another problem are long-term complications. So if you're taking a drug because you have a chronic mental illness, you're going to be on this drug for a long time. So what are the consequences of taking these drugs for such a prolonged period? Well, a lot of the research that's done, it doesn't look at these long-term consequences. So antipsychotic drugs can cause this tardive dyskinesia, which is hand tremors and involuntary movements, in 25 to 33% of long-term users. Some studies that have looked at the effects of Ritalin, okay, and remember how much children are being prescribed Ritalin, they only looked at 14 months. So we don't know what happens to children who have been taking these drugs for 2, 3, 4 years. So we don't know what these long-term complications are going to be. And the problem is using these drugs, even if you're using them properly, they can be dangerous and life-threatening.
And of course, there's always human error in the prescribing or not prescribing medication. In this case, there's a possibility that physicians are over-prescribing some of these medications and treating people with, for example, antidepressants who just happen to feel mildly sad at the moment. And they'll be prescribing these medications without really consulting a psychologist or a clinical psychologist or psychiatrist at all. So just general practitioners regularly assigning these kind of medications with only the most primitive knowledge of psychological principles, which is a concern. So many physicians might be inappropriately prescribing these drugs, while also these same doctors may prescribe drugs for psychological problems that they weren't designed to solve.
Well, when you're talking about over-prescribing drugs, there have been cases where Ritalin has been prescribed to 2- and 3-year-olds. So remember what the symptoms are of Ritalin: hyperactivity.
The disorder being attention deficit.
Attention deficit disorder. So Ritalin is used to treat this disorder. Well, now being a toddler is considered a disorder for these children who have been prescribed this drug.
Right, when there was no mechanism for even diagnosing attention deficit hyperactivity disorder in children that young. Some babies are getting these medications. It's very weird.
Well, the other issue is that medication is only going to help if the root cause of the problem is biological. So remember, these biologically based treatments assume that it's a biological cause and you can treat it medically. Well, if the root of your problem isn't biological, then this is just going to be a band-aid for the problem. So imagine your symptoms are caused by your environment. Maybe you live in a stressful environment. There's so much pressure that you just feel overwhelmed. Well, if you and it produces panic attacks. Okay, well, taking Valium to produce a sense of calmness isn't going to help you resolve your actual problems in the environment. So this is a situation where you need to actively do something to change the environment you're living in order to reduce your symptoms. Taking a medication doesn't solve the environmental problems. And as soon as you stop taking the medication, the problem will come back.
While there has been some historically other biological strategies, there's no doubt that drug treatments are the most common biological treatment. And I should mention, when we say biologically based, we really mean more specifically neurochemically based, that there's something in the way your brain operates that causes you to have mental illness. The alternative to that is still biologically based. Everything arises from your brain. It's just that it's the circumstance that you as an organism are in that might be causing your mental illness. The stressful environment, as Lana was saying, or your thought patterns are just not quite right. And that's at a different level than the drugs are able to treat. Different strategy was quite common in the 1930s and 1950s, and it's called psychosurgery. Quite a sadly common procedure in this time frame was prefrontal lobotomy developed by a guy named Egis Moniz. And this was used as a common treatment for schizophrenia all over the place. Schizophrenia, as we mentioned, is associated with hallucinations, a lot of wild, crazy behavior, inappropriate behavior. And so what Moniz discovered is that if you take a knife and sever the prefrontal lobotomy, that whole front chunk of your brain, from the rest of the brain, the people with schizophrenia don't behave bizarrely anymore. They start to just calm right down. In fact, you might say they have no personality at all anymore. So that's what this does. It eliminates the positive symptoms of schizophrenia, but also eliminates a number of other abilities and behavioral traits that are necessary to healthy functioning, like motivation to do things, the ability to form an opinion on an issue or even understand an issue. So these people are basically dead, brain dead as a result of the surgery. Well, don't have any hallucinations anymore or any inappropriate behaviors that might make them hard to deal with in, let's say, a mental institution.
So we have a disturbing video on the history of lobotomies as a treatment for psychological disorders. I will warn you, though, it is a disturbing video, but it's link number 13 in the Unit 8 links folder.
And this video will also show that prefrontal lobotomies were not only performed on people with severe mental illnesses like schizophrenia. It would be used from anybody ranging from a naughty and disruptive child to a depressed housewife. It became a little bit of a fad to get prefrontal lobotomies done on family members who were hard to get along with. So very disturbing. There's other biological strategies like this psychosurgery, not quite as severe as a prefrontal lobotomy, but some cases doctors will perform a cingulotomy, which means burning holes in the brain's frontal lobes. And this can be used for severe cases of that obsessive compulsive disorder that we talked about, where a person might have an obsession that they're going to be killed by germs, and they might engage in all these ritual compulsive behaviors in order to avoid death by germ. Okay, well, burning these holes in the frontal lobes has been shown to reduce these symptoms, so they thought. Doesn't seem to be any scientific evidence to support that idea, however.
Electroconvulsive therapy is another biological strategy, and this involves passing electric current through the brain, and this triggers a seizure that lasts for about a minute. Although it sounds horrible, it's actually an effective treatment in extreme suicidal cases of major depression. So it's a relatively safe procedure, but for some individuals there may be memory problems and brain damage.
And although this therapy is generally used only in these severe cases of people that are really at imminent threat to commit suicide, and it's done much more safely, the history of electroconvulsive therapy isn't great either. It used to be used for all kinds of mental illnesses with no evidence that it actually had any effect on, let's say, schizophrenia or some anxiety disorder. Many people underwent this therapy and it was not effective in treating their disorder, we now know. More than that, often people would be attached to these electrodes zapping their brain, and they wouldn't even be tied down. So if you zap a person's brain, what will happen is their limbs will start flailing, they'll start bouncing around on the stretcher that you have them laying on, and many people would fall off and break their legs, and it was just a completely brutal treatment, and nobody seemed to be concerned over these people and the limb damage they might suffer. Now people are strapped down and sedated so that it's not nearly as violent a therapy as it used to be. I'm sure on YouTube you can see the most horrifying examples of ECT imaginable. Okay, so moving along from those biologically based treatments for mental illness, we're going to talk about some psychotherapies. There's a whole bunch of different types, so we'll just try to give you a sense of each of them. Psychodynamic therapy is talking at length for many, many sessions over many, many years with an expert that performs this kind of therapy. And the whole goal is to figure out what's going on in your unconscious that's making you behave if you have a mental disorder. What's going on in your subconscious mind that's making you behave in such maladaptive and abnormal ways. So the way you go about this is through the process called psychoanalysis. The client's task is to talk at length about their thoughts, events that happen in their childhood, their relationships, dreams they've had. They talk and talk and talk about themselves. And then from such ramblings, descriptions, the psychoanalyst task is to determine what are the main unconscious conflicts or desires or motives that the person's conscious mind, their ego, is too afraid to admit to itself, too afraid to confront. So the psychoanalyst has to determine what these unconscious conflicts, etc., are and bring them into consciousness. And the idea is that a person's disordered behavior comes from these unconscious conflicts, and just making a person aware of them will then resolve the conflict and they'll be all better. And this is why this kind of therapy is known as insight therapy. You gain an insight into the cause of your mental disorder and then it goes away. However, it takes forever for the sorry about the spelling mistake in the slide, by the way. Look at this. It takes forever for the psychoanalyst, first of all, to figure out what the unconscious conflicts are, and then to make you realize them in a way sufficiently so that they no longer influence your behavior. Backbreaking work for the therapist, but very, very well-paying work.
So, like Jason said, the goal of the psychoanalyst is to let people get control over the causes of their problem psychological behavior by becoming aware of these unconscious problems or conflicts. So imagine you are suffering from headaches and anxiety and you decide to go see a psychotherapist who does psychoanalysis. You might think you're going to start talking about the symptoms you have, but they don't care really about those symptoms. What they care about are these unconscious sources of conflict. So it could be months or even years before you would even describe what your symptoms are. Now, some of the techniques they use is free association. So I say button, you say
fly.
And you would do that, and based on what the person's responses are, you would get an idea about their unconscious motives for behavior. It's the same thing with dream interpretation. You record what your dreams are, and then the therapist goes through and interprets them according to their theory of what each of the different underlying meaning is of all the different objects in your dream.
Right, remember the dream symbolism we talked about way back in the course. For us, it wasn't that long ago, but for you, it might have been many, many weeks ago. So these techniques are just to find clues as to what unconsciously is going on in a person that's causing them to behave in such inappropriate, disordered ways. While the traditional method of psychoanalysis involves, as we've been talking about, multiple sessions a week for many years, you just talking with the therapist, trying to bring out these unconscious conflicts and figure out what they are. For most of the session, the psychoanalyst doesn't do anything, just listens to you talking to the client. Might take extensive notes, but they do this on purpose. They want to provide a blank slate for you to project all your feelings onto. They have the idea that a person's patterns in dealing with relationships are informative about the kinds of relationships they had earlier in their life, and so the therapist uses this as an opportunity. Be completely neutral so that anything the client does in reacting to the therapist must come from the client's past life and the types of relationships they formed in the past. So it's again a clue of a person's past and the conflicts that might have arisen within a person's past. So this minimal responding is to encourage what's called transference, which is just a person acting out their patterns that they've established in the relationships they've had in their life, acting out their unconscious conflicts and desires, etc., through their interactions with the analyst.
Well, the modern methods of psychoanalysis are now much more targeted. So remember before I said it could be months or years before you talk about what your specific symptoms are. Well, they don't do that now. Now they target specific problems, and this is to reduce the length of the treatment and also the expense of the therapy. Another psychotherapy is object relations theory, and the assumption behind this theory is that all of your future behavior in relationships is determined by your early childhood relationships. So you want to seek insight into how your current relationship problems might originate from childhood experiences.
Right, and object relations theory is really just a more efficient version of psychoanalysis. Psychoanalysts always took a lot of heat for taking so bloody long to figure out what people's problems are. So these people just narrow the search and focus on the relationships. Okay, so that's one version of psychotherapy. There's another one that's based more on the behaviorism perspective of psychology. This idea that really all behavior is controlled by prior learning of a stimulus and a response. So we might learn really maladaptive responses to situations, and then the goal of therapy should be to cause a person to unlearn these maladaptive responses that were acquired earlier. So it's not the unconscious mind or conflicts that behavior-based psychotherapies don't care about any of that. You focus on how people acquire these maladaptive behaviors through learning, and then once you figure out what supports a person's behavior, why they, for example, are getting what in their environment is rewarding them for behaving so maladaptively in such a disordered way, and you just try to reconstruct things so that they learn not to engage in those behaviors and get rewarded for not doing it. So these are the important questions. How did a person learn to act in ways that are harmful to themselves or others? And what is it in their environment that rewards them for acting in these ways? So if you just restructure the reward system, eliminate the rewards for engaging in that behavior, and reward the person for doing the opposite, you might be able to eliminate these maladaptive responses.
So systematic desensitization is another therapy, and this is good for treating phobias.
So this is a behavior-based therapy that stems from that behaviorism approach to therapy.
So I'm terrified of snakes. I know we mentioned this earlier, and it's probably because of a conditioned fear response to snakes when I was younger. Now, if I were to try and get rid of this phobia with systematic desensitization, you would replace the fear response with the opposite response. So this would be something like relaxation. So the idea is you're trying to repair the stimulus with something that doesn't promote anxiety anymore. So it's with this feeling of calmness instead of fear. So you would start mild, and you just have someone imagine a snake if they have a snake phobia, and get them to be able to do relaxation techniques while they're just imagining it. And then you slowly start working towards more extreme forms of imagination to the point of then being able to put a snake around someone's neck, which I don't think I could do. But you would just keep building the person up until they could get to this stage where they've overcome the fear.
And this treatment is extremely effective for dealing with phobias. So just here's the kind of thing you might do if you had a fear of heights in order to gradually desensitize somebody from their fear of heights. So you would first start them off quite small until you get a relaxation rather than a fear response to something like I'm standing on the balcony of the top floor of an apartment building. That's an imagining. And have them imagine that kind of thing. And then, of course, up here I'm walking on a 1 meter wide ridge. So your goal is to work them up to this point where they don't have that intense fear reaction to even imagining being in a situation where they'd be looking down from some great height. Okay, well, another of these behaviorism-based therapies is known as aversion therapy. So that has to do with if you wanted to quit something that's not healthy for you, you are an alcoholic and you want to stop drinking, then you can use a learning process to really discourage you from drinking. So what you do is you use just classical conditioning principles so that a person has alcohol and normally feels great from it. So the unconditioned response of alcohol is, yay, it's fun, they feel euphoria, and they feel like all their problems are at least put on hold for a few hours. But now what you can do with a person that suffers from alcoholism is you can combine the consumption of alcohol with them consuming what's called an emetic drug. And so anytime they consume the alcohol, they feel extremely sick as a result of it. So do this time and time again until eventually the conditioned stimulus of alcohol produces nausea all on its own. So you've caused the person to learn an association between the alcohol and that nauseous response because you've paired it so many times with the emetic drug. So then it makes a person sick to drink. They're less likely to consume alcohol, obviously.
So exposure or flooding is another treatment that someone can engage in if they have a phobia. So imagine you're afraid of public places or confined spaces. So you would probably avoid going out into public places where it'd be crowded and you might feel confined. Well, avoiding something that makes you scared is no way to eliminate the fear response. Okay, so you're never learning that you can overcome this anxiety, that just because you go into a public place, that feeling that something horrible is going to happen, well, you never learn that it's okay, nothing horrible happens when you're out there in public. So with exposure or flooding, you force people to come into contact with whatever object or situation they're afraid of. And the idea is that by doing this, you'll force people to replace their fear with a more rational response. And here, the virtual reality technology has been really amazing in helping people with these exposure treatments, because you can create a situation that will produce this anxiety and they can learn to deal with it in that situation, and then you can bring them into the real world and have them, well, face their fears and realize that just because you get that anxiety response and you think you're going to die during this panic attack, you don't. So if you're afraid of confined spaces, the therapist might have the client go into an elevator and they have to stand in the elevator and they might have a panic attack and they might want to just get out of there because they're so terrified. But you keep them in there and they realize that nothing happens. They're still okay and they can get out and they're going to be okay. So it replaces this fear with more rational reasoning.
Right, but it's more aggressive than the systematic desensitization because the goal is actually to overwhelm the person with fear, and then once that dies down, then they're just left with exhaustion. And now you've paired exhaustion with the situation. Plus, you paired as Lana was saying, the realization that it's not going to kill them. So then it's sort of a quicker way to wipe out these phobias. Might be a more traumatic way, though.
Well, there's a video illustration of exposure therapy in link number 14 in the Unit 8 links folder. And it shows really nicely how someone can come in with this intense phobia and how quickly they can progress from eliminating it with this exposure therapy.
Yeah, if you have a fear of, for example, public speaking, the best thing to do is throw yourself in front of a crowd and even make a fool of yourself a couple of times. Once you realize you don't die from it, it's a lot easier to do. Okay, so there's some other techniques that behaviorist-based therapies rely on are behavioral records. So a client might come to see them and describe some maladaptive behavior, like I can't study because I'm too afraid of failing tests. I'm actually unable to study. And then a person might ask for a diary of events to get a sense of the kind of rewards that might be causing a person that's enrolled in classes to not do the studying they need to do to perform well. Okay, so what is it? What are the rewards in the person's environment to maintain that anything but studying type of behavior? It can be difficult to know what's supporting behavior for individual people, so you have to know a lot about their life to get a sense of what's supporting this. Why are they being rewarded? And how can we change things so they get rewarded for doing things that are more functional, like studying hard and wanting to study for their tests?
So skills training involves teaching people to respond in more productive ways. So think back to when we were talking about children, and if you punish them, if you say, no, don't do that, you should always provide how they should respond, what you expect from them. And it's very similar here. Imagine someone, every time they get upset, they act out. Maybe they throw things, they become violent. Well, you need to teach them that there are other alternatives for them. So you teach them the skill they need to describe how they're feeling or be able to identify the true source of their problems and deal with it in a reasonable way. So it's just replacing these maladaptive behaviors with new skills that they need to learn.
And often they'll rely on a lot of role playing or putting a person in scenarios to model the kinds of behaviors they should do and explain why that'll ultimately be more rewarding for them. And so often they'll actually put people in scenarios to just train them up on the best way of dealing with them.